name's Andrew. I go to Manurewa High School. I'm 17 years of age. I like to learn a bit about physio because I'm interested in sports and stuff.
We've brought Andrew along to his local hospital where he's going to experience a couple of days exploring the work of physiotherapy and occupational therapy. First up, physiotherapy, and his mentor is Eti Talivave.
My name's Eti. I understand you like to do some physio.
Yep.
Cool, follow me.
Sweet as.
Eti and Andrew get straight to work. The patient is Chantal, who had an accident while pruning a tree. After a serious fall, she has a broken tibia, injured shoulder and a head injury. Eti assesses what physiotherapy is required by a question and answer session.
And before you had this injury, were you getting around the place using any walking aids? Are you in any pain at the moment? If you were to rate the pain out of a score of 10, where would you score the pain at the moment?
Once the patient has been assessed by Eti, then he decides what equipment is necessary to carry out effective physiotherapy.
Does that feel okay on your leg there?
Time for Andrew to get some hands-on experience.
Cool, so what I'm going to do is I'm going to get you to put this on the patient.
Yep.
And I'll guide you through it. Just slip it in there. A physiotherapist focuses on a person's physical abilities. Basically, if their physical ability is impaired, we work on correcting it. Good work.
Cool.
Nice.
The gym is an integral part of the physiotherapy area.
So this is our gym, mate.
Yeah. So this is a really physical job, really hands-on.
It's really physically demanding. Basically, you're the one that makes sure the patient's safe, so you take a lot of their weight.
Chantal is a trainee physiotherapist.
What do you enjoy most about your job?
It's a really rewarding job. Like it's really good when patients walk out the door and are just so happy that you've kind of helped either to ease their pain straight away or just as a gradual process to help them with getting their function back, like walking or just everyday things.
Physiotherapy focuses on patients' mobility, whereas occupational therapy focuses on patients' activities of daily living. Rio is an occupational therapist, and as Rio says, physios teach people how to walk again, while occupational therapists teach people how to dance.
Occupational therapists use the term occupation to define how people look after themselves, which we call self-care, work, which we call productivity, and leisure activities.
Time for Andrew to take Chantal, the patient, out for a spin in her new wheels. It's important for patients to feel comfortable with carrying out everyday chores.
So how is this going to help her when she gets home?
Chantal has her own little vegetable patch at home where she manages that daily. And so this is meaningful to her. It's getting her back into something that she would do every day, as well as giving that shoulder, like we've been doing, a good workout.
So you need to know a lot about the body and how it works every day.
Yeah, occupational therapy does involve a variety of skills, and certainly what you learn at university is your basic human anatomy and how the body works and the brain functions, and the rest of the stuff is really you pick up on the job as you go along.
But what makes a good occupational therapist?
I think someone that's willing to be a part of the team and to problem solve creatively with your clients. So if you're good at things like art, like working with your hands, that's normally a good pointer that you would be a good occupational therapist.
However, occupational therapy is not all about bones and muscles.
So Andrew, the type of injury that Chantal's had, falling off a ladder, has probably affected her memory. So there is a test we can do called the post-traumatic amnesia test to look at her short-term memory and her long-term memory. Now, Chantal, the area of your brain that's been affected and that controls your memory is called the temporal lobe, which is what you see in the front. And I'm going to get Andrew to do a few examples of remembering some pictures to see how you go on there. Is that okay? Good.
Cool. All right. So there we go. There's James, Sarah, Catherine, and Scotty. Can you remember those people? You remember who that is?
James.
James. You remember who that is?
Catherine.
Catherine. You remember who that is?
Sarah.
Sarah. Can you remember who that is?
Scotty.
All right, so you got 2 out of 4, so you're missing out 2. What does that mean?
Okay. That probably means, Andrew, that Chantal does have some issues with memory retention, and it's a good pointer for us to continue doing some work around getting a memory back to possibly the way it was. So we'll work on that together.
Okay, cool.
Physical injuries can also affect taste, smell and touch. Occupational therapists have tests for all and can help affected patients accordingly.
So this is all fun and games, but how does this help her?
Chantel, since she's had the injury, has lost some of the condition in her shoulder, so the muscles aren't as strong as they used to be. So the action that she's doing right now is actually helping to get those muscles conditioned back to their normal function again, which she'll need to be able to do everyday tasks.
So could this be the job for Andrew?
Yeah, I think Andrew was great. He took on board everything quite well and didn't need much prompting, and he got along quite well with the patient. I think he'll be a great OT.
I think Andrew did really well. He demonstrated good people skills. He wasn't shy to give instructions.
Overall, I found it quite exciting. Occupational therapy, I didn't know much about. Physio, I knew a little bit about, but by the end of the day, I knew quite a bit about it. I think physio is a job for me.
To become a physiotherapist, you need to have a degree in physiotherapy. The Bachelor of Physiotherapy takes 4 years to complete. You must be able to empathise with people's physical problems